Welcome guys, my name is Omar, aka Daher Radiology, and today we're going to be talking about interventional radiology. So let's get started. Alright, so today we're going to get started on the topic of interventional radiology. Definitely can't cover the entire topic in this one video, but we'll try our best to do a nice brief overview. So we're going to talk today about differences between diagnostic radiology and interventional radiology, types of procedures that happen in interventional radiology, community versus academic practices within the scope of Canada as I know it, as well as the call life, the pay of interventional radiologists, and some of the pros and cons as an overview to the profession. So let's get started with number one, differences between diagnostic and interventional radiology. So in diagnostic radiology, this is the classic radiologist who interprets a scan at their office or PAC station, where a scan is ordered for diagnostic purposes, whether that be an X-ray, a CT scan, an ultrasound, an MR. All of these scans are interpreted and reported by diagnostic radiologists. The interventional radiology is really the branch of radiology that deals with particular interventions. And we're going to talk about all the types of procedures in the next point. But using actual radiology images, such as ultrasound, CT, and combining them with procedures that are done in clinics or in procedures that other physicians may be doing, you can combine the two to create an interventional radiologist, one who takes procedures and imaging and helps guide procedures using imaging. Now, that's kind of a basic, brief overview of what a interventional radiologist is, and they are still diagnostic radiologists in the sense that they read scans and they use scans to help facilitate their procedures. So techniques that they use, for example, are using ultrasound to help facilitate a biopsy, or using fluoroscopy, which is sequential X-rays, to help get into endovascular treatments of particular diseases. So basically it's taking radiology, the diagnostic part, and taking it a step further with an actual intervention that you're doing for the patient. So minimally invasive is what comes up in a lot of online forums and articles talking about small nicks into the body, and you can do a whole bunch of different things using instrumentation. That's definitely what interventional radiologists do. They basically do minimally invasive procedures that can be anywhere in the body, and they use certain techniques to do so. So when you're trying to differentiate diagnostic radiologists from interventional radiologists, the main difference is that interventional spends most of their time doing these procedures, whereas diagnostic spends most of their time reading scans and interpreting scans. Like I said, both have overlap, so diagnostic radiologists definitely do some interventions, and interventional radiologists definitely do diagnostic work. Alright, so let's talk about point number two, the types of procedures that happen in interventional radiology. So like I said, interventional radiology is using a whole bunch of different techniques, different tools to do different types of procedures. The kind of categorization that I'm going to divide this in are very broad topics. Specifically, when you're dealing with different types of organ systems, there are different terminologies. But overall, I think if you were to describe the procedures as an overarching theme, these are the categories that I would definitely label them as. So number one, is angioplasty. And angioplasty is used to repair vessels in the body. And if you've ever heard the term of endoscopic or vascular surgery when they do endoscopic procedures, this is very much similar to what an interventional radiologist does with angioplasty. So when you're dealing with a vessel, if there's a blockage, for example, you can actually unblock that vessel by going into a vessel through the thigh, the femoral artery, for example, and maneuvering that through the sewer system, as they say, or the piping system of the body into the different vessels leading almost anywhere. So if there's a blockage of an artery, for example, in the heart, or if there's a blockage in an artery, for example, in the brain, you can get to those blockages through the arteries of the body using different techniques. And once you get there, you can perform angioplasty to help repair or unblock the artery that's causing pathology. So angioplasty is a huge overarching theme, many different divisions as to what you can do with angioplasty, but it is really the core of interventional radiology and what interventional radiologists spend a lot of their time training. It is definitely the more complex type of cases that are dealt with in interventional radiology, and we'll leave it at that for now. So the next theme that we're going to talk about is stenting. This usually uses small mesh tubes or non-mesh tubes, just metallic tubes, if you will, within the arteries that treat narrowing or weak arteries. And this is basically saying, okay, you have a diseased vessel and it's either been damaged, for example, in a dissection or in a tear, in a trauma, and you basically need to repair it. It's as if, the bridge is broken and the construction company has to come out and do something to repair the bridge. The infrastructure is still there, but you have to do something to repair it. So stenting is a way to basically use instrumentation to repair the already in place system that's used to deliver blood to certain organ systems. So let's say there's atherosclerosis. It's blockages of plaque and calcium within the vessels, and it's gotten so narrow that one of the vessels in the neck is now not providing blood to get up to the brain, and that's causing stroke-like symptoms, or is caused a stroke already, or a blockage completely. So stenting is a way where you go up to the diseased area and in basically a tunnel that's collapsed, and you open it up and you use stents that are metal-like tubes that are basically collapsed, delivered to the area that needs to be delivered to, or the pathology, and then opened in that area where there's a blockage to help open up that area once again. So stenting is a real cool way for blockages and for repairs of damaged vessels. So that's theme number 2. Theme number 3 would be thrombolysis, or the breakdown of clots. And while this is a overarching theme again, it's a way to once again deal with pathology inside vessels. So when you have blockages of certain vessels that are caused by clot, you can go to those areas and thrombolyse them. So basically cut up the thrombus, and that may be mechanically cutting them up or using medications to cut them up, but essentially it's the same idea where there's a blockage of a vessel and you're trying to break it free. One of the biggest upcoming uses and current uses within interventional radiology is point number 4, embolization. So whenever you hear, if you're in medicine already, that you need to get embolization to an organ because of bleeding, because of cancer. This is done by an interventional radiologist. So embolization is basically the practice of actually the opposite of what we were talking about earlier, where you're, instead of opening up a vessel, you're using the vessel to close it off and prevent blood flow to a certain area. So the biggest uses for this particular division is when you're talking about cancer, for example. Let's say there's a lesion in the liver that is, small and maybe potentially not something that needs to be cut out completely, because there's obviously high risk to a procedure like a complete liver resection or cutting out parts of the liver because of a metastatic or tumor of some sort. So instead, you can actually target using a minimally invasive procedure of embolization. So you can actually get to the area of where the liver is supplied to, and that particular segment of that liver, and send off basically embolization, either coils or glue. I won't get into the details of that, but basically block off the actual supply of blood to that segment, so that that segment dies, and with it the cancer cells die with it as well. And that way, it's a minimally invasive procedure. The risks of open surgery are reduced significantly, and it's very targeted therapy where the rest of the liver is hopefully not being affected. The other large use of embolization is when there's a bleed. So I'm sure if you're in medicine, or even if you've just watched any of those medicine type shows, you'll know that if a patient comes in bleeding, it's really between one or two things. You're either going to surgery or you're going to get embolization. And a lot of the times, for example, when you have a trauma where there's a bleed, let's say a rupture or a laceration of an organ such as the spleen, then the idea is, well, if the spleen keeps bleeding, then that patient's going to die because they're losing blood at a rate way quicker than we can give them blood and that the body can handle. So something needs to be done. And in a lot of the times in interventional radiology, they embolize an area to prevent further bleeding. So they'll actually embolize the spleen so that it'll stop bleeding and it'll stabilize the patient, and then the patient can be resuscitated with more blood. So that's a very practical use, especially if there's small bleeds somewhere where it's hard to find, or you don't want to open up the entire body just to get to that area to tie it off surgically. So this way you can actually use fluoroscopy, find where the bleed is, actually show it on imaging to be very specific, and then embolize a particular vessel to stop it from causing all of these problems, all through one nick in the thigh in the body, which is pretty cool. The next subsection is what we call radiofrequency, or basically a method of using a type of shockwave or microwave or radio wave therapy within the body. And this is a bit more complicated, and it is used a lot in cancer therapy in a way similar to what we described with embolization. However, a little bit of a different technique. If you are interested in this, you can go ahead and look up these types of things. Radio frequency ablations, for example, is another method of which interventional radiology actually hits certain targets or cancers within the body. Finally, the last theme or last section of procedures is biopsies. This is probably one of the biggest parts of an interventional radiologist's practice, and it is one of the parts that is the most important, because interventional radiology basically uses, like I said, minimally invasive techniques or image guidance to the image guidance to biopsies, where they use ultrasound or fluoroscopy or even CT to guide a needle in a specific way to get targeted pathology or samples of something that's suspicious within the body. A lot of the times in the past, this was done blind or through surgery, which is very high-risk procedures. Nowadays, you can basically biopsy many different things as long as it's safe, and it is done under ultrasound and CT guidance, which is very, very accurate, so you know exactly where you're going and where the needle is at all times. Biopsies play a huge role in determining the treatment of different cancers and different algorithms of how to treat certain things based on the pathology that comes back. So once you get a sample of a tissue within the body, it can be sent off to pathology. It can be characterized in a more specific way, and it can be targeted with therapy in a much more aggressive or maybe less aggressive way, depending on what it comes back with. So those are all of the themes in interventional radiology and what it offers. There are many more components to interventional radiology, such as, gastric tubes, drainage tubes. These things can be looked up online if you are interested in these. I won't talk too much about it. Maybe I'll make another video in the future taking more specifics if people are interested in that, but I just left it as it is for now. Next, I wanted to touch upon community versus academic practice. I won't go too deep into this because it's a whole topic by itself, and it applies really to any field of medicine. But essentially, when people describe a community practice, it's a very different practice than an academic practice. Academia is where the big institutions have multiple learners, medical students, residents, fellows, where there is a whole bunch of learning to be done. So when you practice in that kind of environment, there's much more levels to it, where you're teaching, you're spending most of your time training, and the procedures that you do are usually accompanied by other learners. In the community, you're providing much more of a service, so it's more fast-paced, higher volume, if that makes sense. And in the community, you're doing procedures and things that are very patient oriented, that needs basically to be done given the facilities that are offered in that hospital. And really in the community, it can change in terms of the way that you practice, because you may not have something available to you, and you may only be able to do a certain type of procedure within the IR room. So there are limitations to working in the community. Overall, the complexity of cases is usually lower within the community. The volume may be higher, for example. And then vice versa, in the academic centers, there may be a much more complicated case that requires multiple people on the team, multiple interventional radiologists dealing with the same patient, the same case, with novel approaches, new medications, new stents, new types of materials that are more of a trial academic basis. So there's differences and subtleties there. I'll leave it at that for now, but you get my drift. The next aspect that I wanted to talk about is the call of an interventional radiologist. I'm going to talk about this within the mainframe of Canada and how interventional radiology plays its role in Canadian practice. So within Canada, there are different structures and different ways to structure call. Some people don't do call at all. Some people do lots of call. In interventional radiology, it's a bit different than diagnostics, because you're basically being consulted to do something to the patient. And in a lot of cases, it's just like if you were to consult a surgeon or even medicine, and you basically get a referral from a referring team saying, hey, this is our issue with this patient, can you help, and what can you do for us? And in that sense, when you're on call, it's more emergent type of procedure, and those things are to save patients' lives and things that need to be done immediately. So you're talking about those embolization procedures that I talked about earlier. A lot of the times those are dealt with in a trauma setting where there's bleeding that's not known where it's coming from, or that needs to be dealt with immediately, and surgery is not an option, so interventional radiology is then consulted. Likewise, with if there's stroke procedures need to be dealt with very quickly, and if it's within a window, they can do thrombectomy, where they actually remove the clot within the affected vessel in the brain itself, all minimally invasive. So call life is different in the sense that you're doing life-saving procedures after hours. Diagnostic radiology is, and I've talked about this in previous videos, take a look at my previous what is call like in my YouTube channel, and that'll give you more of an idea. The next section, which will be very brief, is the pay of an interventional radiologist. This is very different where you practice. In Canada and the US are very different numbers, so if you're looking them up online, they may actually be significantly different. In Canada, interventional radiologists, their billing system is less than the diagnostic radiologists. It is a bit outdated, and I think this will be corrected in the future. However, at this point in time, when you bill for a procedure and the time that you're committing to actually doing that procedure, overall the billing is actually significantly less when you are comparing it to a diagnostic radiologist who may be reading a lot of MR type scans that are more efficient for the money that they are offering. That being said, when you work as an interventional radiologist, you're usually as part of a group. So your asset is actually that you're giving to the team essentially a service that is provided to the hospital that is very, very important. So you are an asset in the sense that you are providing a service that everyone needs, and so the pools of pay is usually divided or subsidized in a sense that you are a part of the team and you are equal in that part of the team, and you're providing services that the hospital needs, so you're valuable, and everyone then divides the funds that are made in equal payments, and etc., etc. This varies significantly across the practices, but I just thought I would put that out there in case you were wondering. In the States, interventional radiologists make way more when compared to diagnostic radiologists, and in certain centers they're quite well remunerated, but I'll leave it at that. Finally, a quick overview. We're going to talk about the pros and cons, in my opinion, as an overview of diagnostic versus interventional radiology. I think at the end of the day, both have their benefits. Interventional radiology has a lifestyle that's a bit more involved. You're acting as a very emergency-based type of service, where if you're called at night to do an embolization or a stroke, for example, then you're going to have to go in the middle of the night. People have strokes all the time. People have traumas all the time. So it is a service that's kind of like a very much an on-call service, where you are acting like a surgeon, and the call may be frequent because there's smaller pools of interventional radiologists and they're dealing with quite a large number of volume. I think that lifestyle is a big part in the differences between the two. Diagnostic radiologists are usually subspecialized, and they're dealing with a particular subset of body imaging, neural imaging, and while the volumes are increasing and incredibly high in today's times, it is a way where can be read at home on a PAC station that's remote, and also can also be triaged in a way where, is this important to be done now? Can this wait? Can another modality be done in the morning, for example? So there is some leeway in that sense. And in some cases there are emergencies, and a lot of emergencies happen overnight. Things like surgical requirements or surgical indications, like a perforation, and all sorts of different types of surgeries that happen with result of radiology diagnosing a particular disease. Those are all emergencies. Strokes in the first place are diagnosed on CT, so these are all emergencies that need to be dealt with immediately, except that in this case you may be at the comfort of your own home, or there may be residents, for example, that are helping out with call, and there was reports initially So there is some luxury there. Interventional radiology, you get to work with your hands, you get to find patient interaction all the time, and you get satisfaction of accomplishing something tangible, and I think that's a very good pro to the interventional radiology. Individuals that are more hands-on work and appreciate something that is tangible. Diagnostic radiology is kind of in the shadow, where there are diagnoses is being made, patients' lives are being impacted. However, you're not at the forefront, or you're not being recognized for that as much as you would be in direct patient contact. Overall, I think both of these fields have pros and cons, and I think there's endless arguments to both sides. I just wanted to give you a brief overview in this video without making it too long, and I hope it was a good introduction to interventional radiology and the differences from diagnostic radiology. I hope this was helpful for everyone. Hopefully in the future I can go more in depth into certain things that people want to hear about. But for now, that is all. Thank you all for watching. If you like this video, please remember to like and subscribe, and we'll see you in the next one.